At Sectra, we think it's obvious that in order to enable efficient healthcare requires efficient solutions to exchange information and resources across different systems and organizations. Sectra has developed our own national scale platform for information exchange and collaboration that works regardless of PACS or RIS or system vendor. It enables the information to follow the patient through its care pathway, often spanning multiple sites and hospitals. Let me show you how it works. So now we're logged into IEP, which is essentially a web portal. The user is presented with a dashboard, which is very similar to an inbox. In the dashboard, we have requests that has come in from other hospitals for images that we have, or requests that we have created and asking for images from other sites. Actions required folder means that it's something we should follow up on. For each transaction, we can find more information simply by clicking. We can also find comments or messages that has been sent or communicated between us and somebody else. The most simple workflow and the most simple problem that IEP solves is the need for fax or phone to ask for images or CDs to send them back. This is done by two simple types of transactions. Normally, the workflow is initiated by request to another hospital. So instead of sending a fax or calling another hospital, the user can type in the hospital from where we want the images from and electronically send a request to ask for the images. When doing so, it's important that we specify enough information about the patient in order for us to find, or actually for them to find the information in their system. How much information that is depends on country. The requesting side can also specify what information that is relevant to send across. It could be specific modality types, it could be during specific timeframes. We could also specify whether or not a clinical report is required. Finally, we can specify where we want the images to, either to our own PACS, or maybe we want the images to the centralized service of IEP, where they can be viewed and a decision can be made if we actually want to download them to our own system. We could also set a priority, depending on how urgent this transaction is. This request has now been sent over to the other site. If we teleport ourselves to that institution, that hospital, we should now find this request in our inbox. The request we just created is presented at the top. And as a recipient of this request, just by opening that, we trigger a search against our own system based on the information provided by the requester. Since we didn't specify what information that was relevant, we need to make a decision on what to send across. We found 3 studies in our PACS. We can add attachments to those studies if we want. And we're guided through the process in a simple step-by-step manner. We can also add a comment in the end saying, this was all the imaging we had. Or other things that are relevant to ensure that communication around the transaction is carried through properly. That easily, we have replaced the need of a CD and sent the images with higher security and better traceability and better speed across to the other site. So now I've showed you how to solve the most simple and common scenarios for information exchange between different institutions. Sectra IEP solves this, but we also use the same platform infrastructure to solve more complicated and complex collaboration needs. Thank you for watching.